All right, we have our first interview of the night of Unite tonight, and I'm excited to welcome the St. Tammany Ochsner Cancer Center. These ladies work there and have something very special to talk about, a new program. Let's tell us about that first.
It's a wonderful program. It's called a multi-disciplinary program where all in one facility the patients are able to get see their different physicians all at once, like the surgeon, the medical oncologist, the radiation oncologist, all in the same morning or afternoon, and don't have to wait sometimes several weeks or longer stressing about their treatment and what's the final plan because they have such a sense of urgency. It's such a stressful time for them. So it's been very well received. We're very excited about it.
And having that all under one roof and having them have the opportunity to see all of their doctors at one time, I'm sure that takes a lot of burden off of a cancer patient.
Oh, absolutely. Because there's so many facets to what I specialize in is breast cancer. I'm a surgeon, and then this is a radiation oncologist and a medical oncologist. So there's so many different facets to the cancer that they have to deal with, all of these different disciplines. And afterwards, they just feel like, okay, some of the burden is lifted. They feel much more relaxed and sure about what's going to happen instead of so scared.
And at your cancer center, tell us a little bit about what you see on a daily basis and tell us about the feel that cancer patients get when they walk through that door.
Right. Well, it's a beautiful center, for one. It's beautiful, very bright, and there's other alternative things there as well that are exciting for the patients. But they just feel warmth and that we care. For me, I do the breast cancer. These other physicians do other types of cancer as well.
And so what's it like for you on a daily basis? And then I'll ask you guys the same question.
So what we'll do is we'll set up these multidisciplinary cases where the patient will come in and typically first see me, and then I'll talk about their basic disease, explain it to them, the pathology, the details of it, and what their surgical options are. And then they just stay right in the room, and then after that follows the medical oncologist, which they might have to explain if they get chemotherapy or other therapies possibly. And then the next doctor comes in, which is the radiation doctor. And then in addition, at the facility, we have other integrative options. So some of our patients, my patients, they'll have to stop their estrogen or have to take anti-estrogen. And so that can give them some really bad side effects. But we have an amazing team there set up that is just focused for that, for them, for alternative therapies to help them get through it.
It's amazing that you have all of that under one roof. So now let's start with you.
Sure.
Tell me a little bit about what you do on a daily basis and tell us about your patients that you have to deal with on a daily basis.
So I'm a radiation oncologist, which means that I treat patients with radiation. And one of the best things about the new cancer center is it has a state-of-the-art radiation machine. It's called a TrueBeam. It can deliver all the top-of-the-line, fanciest treatments for any of the clinical trials. So another amazing thing about the cancer center.
It's okay, that's what it's about.
I mean, it's amazing. What am I supposed to say? Is that because Ochsner and St. Tammany have collaborated in this way, patients can now get access to the largest clinical trial network in Louisiana on the North Shore. So they can get access to groundbreaking cutting-edge therapies much closer to home. And my machine is part of that. So we do, nobody's going to know all the ridiculous nerdy things that I do with my machine, but just know that they're fancy and we do it all. And we're the only facility on the North Shore that's got one. So people no longer have to take that $5 drive across the causeway every day. I didn't know there was a toll. I found this out the hard way. But it's fantastic. It's wonderful for patient care. They get faster treatments each day. They get fewer side effects. And as what Dr. Buonagura was saying, as far as our multidisciplinary clinic goes, it's really the best way to deliver care for patients. All of the treatment team is on the same page. There's no waiting for one doctor to email another doctor and find out what this one's planning and what that one's planning and make sure that everyone's on the same page. We're all there in the same room. We're on the same page. And it's really reassuring for patients to know that their entire team is there working together as a team the way it's meant to be.
All right, so teamwork is super important to you guys. And I mean, I'm sure that that's really important when someone is going through the struggles and battling cancer. So that's truly amazing. Thanks for sharing that. Okay, now it's your turn to tell us a little bit about what you do on a daily basis.
So I'm one of the medical oncologists. I do specialize in breast oncology, but I do other solid tumors as well. And as my colleagues have already said, we love our multidisciplinary clinic because we talk about the patients before they even enter the room. So we have already looked at all their records and formulated a rough plan. Of course, anything can change once we speak to the patient and kind of have an idea what options do we have to offer the patient. And then we usually work really, well together and talk to the patient, as you said, one after the other. And patients have told me how much they appreciate that and how simple it was and how they came in the morning and they left with a concrete plan at the end of the day. And I'm very, very proud of that, that we are actually doing this on the North Shore. And the other thing that I'm part of is phase 3 clinical trials at the St. Tammany Ochsner Cancer Center. So we have a number of trials to offer our patients who are appropriate, and that is a great opportunity for them as well to get cutting-edge new technology, new treatments. So yes, I come to work happy and optimistic every day, doing my best to take care of my patients, and just very, very proud to be part of this team.
That's amazing. Something that we were joking about earlier as you guys walked up, as we were setting up, was talking about how we were looking like a girl band up here, and it sounds like that is what you guys are in your clinic, is you guys have such a great, good sisterhood, a girl group to take care of these patients. So I think that's really important that all of our viewers out there get to know. Do y'all have anything else that you want to add?
So I've got this new cutting edge thing that we've pioneered. We're the first to do it in New Orleans or on the North Shore. And it's where we can actually save the nodes, the lymph nodes. And that is such a big deal. It's not in all cases, but in special cases where we don't have to take the nodes because we can put a special marker in them. And if we have to go back, which 90 to 95% of the time we don't need to. And so it helps avoid the risk of lymphedema, which is swelling of the arm after the surgery, as well as injury to the nerves or chronic pain. And it avoids unnecessary surgery. So it's called MagTrace, and we're extremely excited to be doing that.
Wow, again, cutting edge. You guys have something unique to offer to everyone in this area. Well, these women are here with the St. Tammany Ochsner Cancer Center, and you're going to hear more from them backstage, and you can find out more information from them on their website. All right, we'll see y'all soon.